is Priscilla and I'm a general practitioner here in Maari Ma. I've been here for like more than 5 years now.
My full name is Ong Sithu. Everybody calls me Ong here. I'm a general practitioner here. I've been working with Maari Ma for the last 5.5 years, nearly 6 now.
So I'm Dr. Steve Grillett. I'm a GP and one of the Maari Ma GPs.
My full name is Amon Han, so I'm a fellow GP in Maari Ma.
I'm Kathy Dyer, I'm the Executive Manager Corporate Services. I started at Maari Ma in 2007 and so that makes this about 13 years.
My name's Lavinia Henderson, or Lil. I work in chronic disease with the specialist nurse team.
My name's Louise Moriarty. My background's in social work, social ecology and circus. And I work for the Strong Young Families program for Maari Ma, and we're based at the Courthouse Cafe, which got kind of renamed Ninya Curly, which I hope I got that right, people.
Bernie Kemp, I'm the Manager of Aboriginal Health at Maari Ma.
My name is Lloyd Zanetti. I'm a registered nurse and currently I'm the acting manager at Maari Ma Health in primary health in Wilcannia.
I'm Daniel Jackman, background as an RN, and my role here is Manager of General Practice. I manage the GPs, day-to-day operations, as well as a team of nurses, health workers and the practice admin.
On the map, it's pretty at the corner of the Far West. But actually, look, it's a typical outback rural town and beautiful scenery. A lot of people think it's far away, but actually it's not.
I love living in the remote region because it's like it's more close to the nature.
For me, it's family, that I can be around my family. Everyone's not far away. It's the quiet life. Broken Hill's just a really easygoing town.
I think it's family friendly. I've got a young family myself, 2 little kids. Everything's close by. It's literally 2 minutes to get to work.
Well, I can tell you that I came to Broken Hill for 12 months and that was 13 years ago. And I got out here and I realised I had an extra 4 hours every day that I didn't have in Sydney.
I really like the lifestyle. It's quite laid back. It's not busy. It's easy to get around, but there's enough here to live comfortably. And look, I've looked to go back to the coast or even looking at the cities, but I find that people are authentic west of the mountains.
There's lots of activities for the kids to do. There's lots of supports for the kids during the day so you can get to work as well, daycare services, and there's lots of things for adults to do as well. It's a very socially sporting town, so if you're into sport then there's lots of clubs to join and social activities to do.
The rawness and the realness of living out here is, I don't know, it's like vital energy. You know, you can't get up and avoid what's really going on. It is a harsh environment. Like, we're out here in the, you know, an environment that's been in a huge drought, but then the rain breaks and look at us now. We've got wildflowers and we've got this amazing beauty that just shows the resilience of the nature around us, and I think you see that also in the people.
I grew up here in my early childhood, looped back 15-20 years later to work in medicine back in Broken Hill. I always wanted to work in Aboriginal health, and so Maari Ma was the place to be for me.
Working for an Aboriginal medical service, you are interacting with families because that's really what Aboriginal health is all about. It's working with the whole person. So someone doesn't come to you with a wound and you deal with a wound. You deal with that person's wound and their diabetes and their social circumstances and the family, the household they live in and the circumstances that household might be in.
So in Double, I worked in mainstream practice, private practice basically. And so here is Aboriginal medical practice, and it's heaps different. Yeah, in terms of work experience, in terms of the communities, in terms of the diseases or whatever, the common medical problems, it's different.
I would say it's definitely different from the practice in the cities, because like here we see a lot of like chronic diseases.
It is more challenging in many different ways. But again, the accessibility is here. It's not like we're not able to access a good quality healthcare. We can definitely access here.
They call Broken Hill the Accessible Outback, and that's very true. What you get here is an experience of remote Australia, particularly service delivery to Aboriginal people in remote Australia, but you do it in a very accessible place, which is Broken Hill, which has virtually everything that you need from a services perspective that you may not necessarily get in places that are much more remote elsewhere in Australia.
One of the big challenges in rural areas is not having access to specialist services and having to do a lot more on your own and hold on to patients a lot longer before you can get that support. However, in Maari Ma, we're very fortunate that we have all those visiting specialist services, so you're not alone.
The service is, the best service that I've seen, with the availability to get into a specialist fields. Like we have services for cardiology, urologists, podiatrists, physiotherapists, and it's a service next to none as far as I'm concerned.
The support that can be provided to a GP and their family if they come out this way, that will give them the opportunity to work with probably a quite complex population of people with a full range of issues associated with them that you would find in general practice, supported by an amazing array of visiting medical specialists that are working within our primary healthcare model. That is, instead of seeing someone with diabetes and saying your diabetes is out of control, I'm going to refer you to an endocrinologist, the endocrinologist comes to us along with the diabetes educator and the foot nurse, and they will provide a clinic in our service, and they will speak to the GP at the end of that clinic, and they will provide a handover back to the GP. So it's the specialist supporting the GP to become that person's primary carer. So it's less of the tertiary model as it is an enhanced primary healthcare model.
It gives you a lot of opportunities that you probably wouldn't get elsewhere. I have also worked in, metropolitan hospitals, big facilities, but working out here, it becomes more personal. You get to know your patients, clients, whatever you want to call them. Whereas in other facilities that I've worked in, people are numbers.
It's more varied. It's more actually personal too, because there's a one-on-one approach.
At a primary healthcare service, it's not that acute care. It's not someone that you'll meet and you'll never see again, and that you help them with whatever they presented with, and that's the end of it. It's relationships that you build, and you'll have them for as long as you're here, and maybe longer, because you build that rapport, you have that connection, and you see it with the doctors. When they see people, they know their name, they know their kids, they know their history. It's that connection with families and with community.
A lot of the GPs have been registrars here and have fell in love with the town and the work and have decided to stay. So we haven't needed to go to market, not for a good long time, probably well before I started, yeah.
Yeah, I worked at the hospital in the emergency department for a year or so. I worked in private practice in town for 2 years. I've also worked at the Flying Doctor base in town as well. But no, I like Maari Ma because, well, I like working in Aboriginal health. I like the people, but I also like the organisation and what they've been able to achieve for the Aboriginal community in town, and it's just a good thing to be a part of.
The progress of the health conditions in our community actually is improving, in my opinion, and that's the most important part, and you are welcome to be part of it.
I'm a self-employed contractor, but I feel like I'm one of the family members of Maari Ma. I don't feel like I'm just an employee. So, and we've got a very good team. So we can have like a different types of support. From other like Aboriginal health worker and RNs and like everybody are in our clinic. They are just like our family members.
Our supervisor here is very so we can knock the door anytime. You can call the phone anytime. So this is very good. And then the teaching here is very good. And when we became the fellow, what is the difference is like in terms of the incentive and the other thing compared to the mainstream practices. So it is very rewarding. For me, the working environment is the main factor. If the working environment is very good, very supportive, so I don't mind about the other remote area or something like that.
Before I worked for Maari Ma, I was a primary school teacher, and there was a young girl I taught and helped her with literacy when she was at school. When I came to Maari Ma, I worked in the lead education program, which was helping families help their kids who had elevated lead levels from the mines. And she ended up coming along and she did the Aboriginal Health Practitioner course. And for me, I still have contact with her today, and just to watch her, the way that she developed and the way who she is now because of her opportunities that she had. And had she not had those opportunities, I don't know, if things would have turned out as well as what they did. But that's a really proud story for me and for her to see, how her life has her little journey has gone from her opportunities here.
One of the other benefits of working for Maari Ma is that the management is very accommodating for doctors and their family or their partner's family that may not be in Broken Hill. So there's a lot of different working arrangements Maari Ma has organised. The organisation understands that the continuity of care is key, and if we find a doctor who likes working for our community, we want to keep them on board, and the organisation is very accommodating in making that happen.
Second time round, or third time, I can't remember. No, look, it's been fantastic actually. People accept you, they're great to work with, and it's a good service to actually work in.
We're very lucky here at Maari Ma, and there's just so many programs because it's that holistic approach to healthcare. With mental health, everything from mental health to working with kids or the social emotional wellbeing team. You can branch out anywhere if you had an interest to do so. So we are really lucky, and we're supported to do all of that as well.
I think Maari Ma is different. It has always been different. It's established itself differently. It was the first regional, Aboriginal community controlled regional health service in New South Wales, and was one of only a very few when it was set up 25 years ago in Australia. And the model has succeeded for more than 25 years now, and has grown significantly from, I think, 4 employees originally to more than 130 now. And we're still 2/3 in Indigenous employment. We're the largest employer of Aboriginal people in Far West New South Wales.
Maari Ma is a place of growth, and it's a place for me that has given me lots of opportunities, opened lots of doors. I've been able to study in different areas that I didn't think I'd ever study in, and pursue something to help people in my community where I didn't think I'd ever have a chance to do that.
I don't think I knew the full scope of what an Aboriginal medical service could be until I I came to Broken Hill and until I worked for Maari Ma. We do things differently and we do things successfully.
If you still like a challenge in your work and you want a rewarding job, then you'll get that here. If you also want a good work-life balance, you'll get that here. And if you want a place that is like nowhere else, you can't put your finger on it, but if you want something that's unique, well, that's Broken Hill.
If you want a challenge, if you're up for a challenge, because all the issues that we're dealing with are complex and you know, they really touch your heart, the issues that you're dealing with. It's real people's lives, and it's trying to find a way to live with understanding together. So for me, as a white fella, it's, you know, I don't know, you just really have to be on your toes in every moment and be ready to, you know, it's a very, I don't know, it's very different because it is very free out here. There's a different, people are operating on a different modality, you know, like it's a different model to the culture of the city.
Yeah, I think we're very lucky and I'm very proud to work for Maari Ma.